Welcome to Pregnant in the Netherlands, your guide to pregnancy, birth, and beyond. I'm Julianna, a birth doula and a childbirth educator.
And I'm Anna, a doula, childbirth educator, and lactation counselor. We're here to support you with evidence-based information and honest conversations that help you feel confident, informed, and empowered throughout your pregnancy, birth, and postpartum journey in the Netherlands.
Hey Anna, good morning.
Hey, Juliana. How are you doing?
Oh, good, really good, thank you. A bit
Good.
tired Friday
Yeah.
morning for us now.
Yeah, I hear you.
Welcome to our listeners.
Welcome. I'm excited to continue our conversation on perineal tearing. Today we're going to...
And how to take care of your perineum after giving
Exactly.
birth.
Yeah.
First things first, after birth, with or without tearing, your vagina or your noonie is not damaged. She's open, tired, probably warm, and healing. So the goal is closing, resting, and nourishing after giving birth.
Definitely. Yeah. And I think it's also important to mention that in first-time moms, natural tearing is very common. It's like somewhere between 60 and 70% of people who give birth experience some kind of perineal tear, usually a lower degree. Last time we talked about first degree, second degree, where the skin and maybe some of the muscle has torn. And that's very common. The higher degree, third and fourth degree tears, those are a little bit less common and require a little bit more attention and repair. But I think some of the things that we're going to talk about today can be applied to whatever degree of tearing you have had, whether it's no tearing at all or you've had experienced a fourth degree tear.
Yeah. The difference is maybe that it will need more time to heal.
Yeah. Yeah. I think in a lot of countries, there's a 6-week follow-up visit that you have with either your midwife or your gynecologist. And a lot of women think, oh, I should be completely healed by that 6-week time point. And I think that we really need to spread the word that it's okay to take longer than 6 weeks to fully heal. So give
Yes.
yourself time and space and patience to take care of yourself. And it's okay if you're not healed by 6 weeks. There's nothing wrong with you.
And I think it's the 6 weeks because that's probably the period while you are bleeding, but that doesn't
Mm-hmm.
mean that your body is back to how it was before. It really
Exactly.
takes some time, some
Yeah.
more time.
Yeah. It takes months and months for your hormones to regulate. And all of that affects your tissue healing too.
Mm-hmm. So what can we do
What can we
to
do?
take care?
Yeah. I would say the first thing is to spend some time every day without any underwear, without a pad. Maybe put a waterproof pad down on your bed to catch any bleeding, and give your perineum some space to breathe and be exposed to oxygen, because that can really help speed up the tissue healing and repair.
That would have been also my first tip. And that's what I've also done. I just covered my belly in a big towel.
Mm-hmm.
And then it also made me just stay in bed.
Yeah, exactly.
I didn't want to jump out of bed all the time. Yeah, just wrap your belly and keep yourself warm and then just let
Mm-hmm.
it air.
Yeah. Another thing is using your peri bottle. This is a bottle that you probably get in is it the Crown packet?
No, it's not
Okay.
normal. I didn't have it. And I was just using a simple water bottle.
But what a peri bottle, or really you just want something to be able to squeeze water out onto your perineum when you're using the toilet. Using toilet paper can feel really rough. So using a peri bottle to clean yourself after using the toilet will feel really good
Mm-hmm.
and
And
help
just
protect it.
maybe tap it with a cloth instead of toilet paper really
Mm-hmm.
gently.
Yeah, exactly. In the US, people usually spend 1 night or 2 nights in the hospital after giving birth, and the nurses create these, pads. So you have your, disposable underwear,
Mm-hmm.
and on that, you're given a really big maternity pad, and then what the nurses do is they'll place these pads that are soaked in witch hazel, which is an astringent, and they put those on the pad, and the astringent can help the tissue to kind of, like, reduce its swelling and tighten up a little bit, and it can feel really good too after
Mm-hmm.
giving birth. It can feel really, cooling and relaxing on the perineum. And also in the US, we use cold packs. We offer people who have given birth cold packs also to help the swelling in the perineum. But I know that a lot of cultures
It's
don't
interesting.
like
Yeah, I heard
having
that.
cold.
For example, in traditional Mexican midwifery, they really suggest warmth
Mhm.
because cold is doing its job too quick.
Yeah.
So you really want to take your time and just lukewarm water or warm water and yeah, keep it warm.
Yeah.
Yeah,
Yeah.
whatever feels nice, I would say.
Exactly. Yeah.
And also, speaking of warm, I know that also in Mexico, what they suggest is that you make a warm bath with different herbs. For
Mhm.
example, calendula, which is a tissue,
Mhm.
chamomile. That's yeah, I think everyone knows it reduces inflammation and soothes. And lavender, you can also put in the blend,
Mhm.
which is calming. Yeah, nice smell, nice for skin repair.
Mhm.
And rosemary can help heal and for the circulation
Mhm.
in a small amount.
Yeah. Yeah. Yeah, you might hear it called a sitz bath,
Mhm.
where it's just a couple centimeters of water, and you're just sitting either in a bathtub or there's, I don't know, there's special devices that you can put on your toilet, and you're just soaking the perineum in warm water, possibly with some herbs added to it. And that can feel really nice.
Speaking of traditional midwifery and ways of healing, belly binding can be also a really nice way to just close. That's a closing ritual. And that
Hmm.
also helps to support the pelvic organs.
Yeah.
But I think what I often do with my clients while I'm giving pregnancy massage is that they are covered and nicely tucked under the blanket, and then I just stroke their entire body from head to the toes. And you can also ask your partner to do it for you. So you are
Hmm.
under your blanket, and then just few times nice long strokes, and it can be so soothing, so nice.
Yeah. Yeah. So I think all of that helps relax
Yeah.
your whole body, but then also it helps relax your perineum, and your pelvic floor muscles, which can help with healing as well.
Hmm. We cannot emphasize enough just rest in the
Yeah.
first days. No stairs. In the
Mhm.
Netherlands, all the houses with all these steep stairs. So my midwife and also my maternity nurse told me only go once downstairs if you really want to,
Mhm.
and then eat or whatever you need to do downstairs and go up, and that's it. So once you are down, you stay downstairs, and then once you are up, you stay there.
Yeah. Yeah. One of my favorite kind of like old midwives sayings is 3 days in the bed, 3 days on the bed, and then 3 days around the bed, to really emphasize, like, don't leave your room for the first week or 2. Really focus on relaxing, resting,
Yeah.
and your recovery. So arrange for your help to come to you into bed. But yes, if
Mm,
you sometimes you can get a little stir crazy in bed, and going downstairs can feel nice too, but
yeah.
not overdoing it. You don't need to be a superhero.
Yeah. That's really important for your body to heal,
Yeah.
and also for your mind.
Yeah. Also helpful to your body is nourishing food. So some well balanced meals that are easy to digest. So, soups and stews can feel really good. Um,
And a lot of fibers so that
exactly.
it's easier to how do you put it in a nice way to go
Have
to
a
the
bowel
toilet?
movement.
Yes.
Yes. That can
Because
feel a
it
little
can be a
scary.
bit, yeah, scary and strange when you have to do it for the first time.
Yeah. Yeah.
And it's nice, yeah, I think it's good to do it as soon as possible,
Mhm.
otherwise it gets even more scary and more bigger and harder.
Yeah, exactly. Making sure that you have a lot of good fats in your diet as well, that can
Mm,
help lubricate things and make that first bowel movement less scary as well. So, some like ghee and olive oils and butter,
avocado.
avocados, exactly. Yeah, all of those things are very nourishing and can help repair.
And you can use a foot stool while you are sitting on the toilet, that might
Mhm.
help.
Mhm.
It's a more natural position.
Yeah. Yeah, rather than sitting high on the toilet, yeah.
Yes. Avoid standing a long time and sitting. That can be also uncomfortable,
Mhm.
sitting, especially if you have stitches. So
Yeah.
lie down as much as possible, and you can also breastfeed on your side.
Mhm. Yeah. Yeah, so I had some, tearing and, repair with stitches with my first, and I when I was first in the first week when I was breastfeeding, I felt most comfortable sitting up to get my daughter latched. And one thing that my midwife told me is don't slide in bed. Pick up your butt as you're moving it so you're not
Mhm.
shearing those stitches. So
Yeah.
take your time getting into position and let somebody help you too with
Mhm.
pillows and moving around.
And dissolvable stitches usually disappear within like 10, 14 days.
Yeah.
And those can be a bit uncomfortable. So it's also good to check with your midwife if you think, okay, this feels really not okay. I also had that. And then she just got one. And then it made such a big difference for me that I could sit again.
Mhm. Yeah. Yeah, and definitely pay attention to signs of infection
Yeah,
in
itching.
your. Yeah, a lot of itching, redness,
In.
some stinky smells, foul smells coming from
Mhm.
the perineum can all be, signs of that the, laceration is infected. Is there anything else that we wanna cover?
I thought maybe sex and intimacy, and that, yeah, to just take your time, no
Yeah.
rush with it.
Mhm.
Do it when you feel ready.
Mhm.
And even if you feel ready, you don't have to go all the way. Like
Mhm.
just check in with yourself if what feels nice and what feels okay. And if it feels uncomfortable or if you have pain, just stop.
Mhm. Yeah, sex with your partner can look different in the postpartum period and even beyond. It doesn't have to be complete intercourse. There are many other ways that you can connect with your partner and express intimacy
Yeah.
that doesn't have to be intercourse, full on intercourse.
And the first time might feel also similar to the really first time, the very first
Hmm.
time.
Yeah, definitely. Using
Oh,
lubrication can be really helpful. Because if you're breastfeeding, you'd be a little bit drier down there.
yeah, can be. Oh, yeah, checking in the mirror down there how it
Mhm,
looks. It can be really exciting. And do it when you're ready and really take your time. And
mhm,
remember that it's not going to be like this that forever. So things will shift and things will change. And it might be, you might be really surprised, like, what is it in my vagina? That's not
mhm,
how it felt or it looked before.
mm. Yeah, and visiting a pelvic floor physiotherapist at some point a few weeks after giving birth, 6 weeks after giving birth can
Yeah.
be highly recommended. I think
You
everybody should.
also have your midwife visit at 6 weeks, or you go to your midwife, or if you gave birth in the hospital, then you have the checkup at the hospital and they can check your perineum if you want that, to see and to make sure that things are healing. Because you might think that,
Mhm.
okay, this is not normal, this is not how it's supposed to be. And then they
Mhm.
can tell you that, yes, it is, and it will still take some time.
Mhm.
And indeed, make an appointment at pelvic floor physio, even without concerns, just to help with some exercises. Don't rush with Kegel exercises and movement. Now that I lost Anna, our computer shut down, sadly. I'm going to share one more thing with you, and that's scar massage. Wait until the skin is fully closed, so no open areas, no scabs, and no signs of infection. And then you can start with the perineal scar massage. Use some neutral massage oil without perfume and apply gently with small circular movements outwards. You might feel a small bump, or that area can be a bit more firm where the tissues were stitched together, and that's completely normal. Also, if you had a belly birth, scar massage can be really helpful once the wound is healed, of course. And there are also silicone patches that you can order and use, designed especially for C-section scars. It is a process of healing the wound itself, but it's also a journey of accepting your body, how it is now. And now, years later, I still sometimes bring gentle attention to my own perineal scar. It reminds me what my body has done. And that's crazy what our body is capable of. It's okay to get emotional when you do scar massage. Not only for the first time, but even years later. Just let it be. Thanks for being here. I hope we could help with some really useful tips about how to take care of your perineum after giving birth. If you like this episode, please let us know, give us a rating, and share this with a colleague or friend who is pregnant or just had a baby. See you soon. Bye bye.